Hello, everybody. You can see us here, I think, because we've gone live. But we're going to take a few minutes to share. Please feel free to comment and to tell us that you're here. We'll take just a few minutes to share as minimally as we can. Hi, Jeffrey Denton. Nice to see you. Hi, Dolores. I know you've been here on YouTube now for some time, and now you're here on Facebook. Thank you. Thank you for sharing. Thank you for sharing. Oh, there's a bit of an echo here, but I'll get rid of the echo as we go along. In fact, I'll get rid of it right now. I just shared to the Red Berets group. Facebook is being very uncooperative tonight. It's not showing me any of the groups it normally shows me.
Hey, Joe, did you get a chance to change the potential YouTube time?
That was not on my promo. In other words, what YouTube is saying, Kay, is what it always says. When I schedule a show, it looks at that as though I've started the show, even though the live stream hasn't started. So that's what I think Shane, why he made the remark he did.
Well, let me just read to you what he said to me real quick, because I just noticed that he texted me something else.
Okay.
He was saying something about if you don't change the time, you're going to have a problem with YouTube.
How come?
He's saying, okay, it says on YouTube that your show starts at 8:14, and it said he's saying here, it will affect Facebook if he doesn't adjust the time. He won't be able to stream to Facebook due to the StreamYard rules if he doesn't adjust it.
I don't think Shane knows, because I am streaming right now to Facebook.
Oh, is it working?
And I'm streaming to YouTube too.
Okay, as long as it's working.
Yeah, it's working.
Cool.
I've been doing this forever, and it always works. It seems like forever now.
And I've only known you for 6 months.
Is it 6 months we know each other already, Madelyn?
Something like that.
It
might be a
like
little longer.
just yesterday.
Yeah. It's not that long, though. It's not.
No, it's not that long. Okay, I think I'm going to end sharing now, because Facebook is not being very cooperative in presenting to me my usual sites. Probably just another aspect of the oppression we all face from Facebook. Okay, so I'm going to shut Facebook down now entirely. That way there won't be any echoes. And we can now start things off. Okay, so what I'm going to do first is, first of all, my guests for tonight are the Green Party candidate for governor of New Jersey, Madelyn Hoffman.
Yes.
Okay, and Madelyn Hoffman just appeared on the show very recently, and we're going to have another conversation with her tonight about state single payer.
Looking forward.
And my guest host is Lisa Theobald, who is joining me to guest host tonight, and she is the operations director of the Red Berets. And
Hi, guys.
also is my very good friend, even though we've only known each other for a very short time. So thank you, Lisa.
Thank you. It's an honor to be here. I can't wait to hear this discussion. And Marilyn, it's so good to see you again.
I'm glad to be here. I was just saying a few minutes ago, though, but that I feel like I don't belong because I don't have a red beret on.
We can fix that.
We'll see if we can fix that.
Yeah. I mean, I'm probably a red beret in my my mind and my heart, but I don't have the red beret to show it right now.
You are a Red Beret in your mind, again, in your heart, because you are for Medicare for All.
That's
and
right.
The full title of the Red Berets is Red Berets for Medicare for All.
So there we go.
Okay, so that's what this group is about, actually. So I'm going to share a bit of a presentation that I did for us but tonight. I'm going to start off in that way. Hi, Amber. I just noticed that you're here with us. Thank you very much for coming. It's always good to see you. I see. I have to shift my focus a little bit here. How would I do that? Get this up on the screen. There we go. So you should be able to do that see that on your screens right now. Can you see the presentation well?
Yes. Yeah, it's good.
Oh, but the type is a little small for me. There we go. That's better.
Okay.
I mean, that's okay. I'll be fine.
Okay, if that's okay, that's good. I have a vision problem myself as well, so I perfectly well understand what that is about, and I will do what I can to improve.
Yes, that's good.
How's that?
I think that's good. And then, especially if you are referring to it or reading parts of it, it'll be fine.
Okay, great. So this is called Notes on Through the States. That's a new slogan that everybody has, at least everybody in the Red Berets has, that we're going through the states to get national improved Medicare for all. And you might wonder how that's done, and we will dwell on that a little bit as we go forward. But there was a new article that appeared in Jacobin just yesterday, I believe. The State Road to Single-Payer Health Care. It was by Casey Buchholz. Spelled her name wrong there. I think it's she, but it could be he. Casey Buchholz, Stephanie Attar, and Gerald Friedman, who is the professor from University of Massachusetts, in Amherst, who did the economic analysis for Whole Washington. Whole Washington is the organization that was formed to try to get a single-payer health care bill passed in Washington state. And when they formed themselves, among the first things they did was to engage Gerald Friedman to do the economic study for them to show that single payer was feasible for them. He, of course, was very well known to them because Whole Washington kind of arose out of Bernie Sanders groups in Washington. And Jerry Friedman had done a lot of the economic analyses for Bernie Sanders' campaign. Anyway, here's a quote from the article. Quote, "State politics can expand our political imagination by demonstrating what is feasible and therefore desirable when it comes to the national level, and can provide incentives for political actors to mobilize to achieve them. Arguably, the most important example for Medicare for All activists to learn from is the history of single-payer health care in Canada." Before I go on, I want to remark that there are many people who would dispute this particular statement because they contend that the situation in Canada in the 40s, 50s, and 60s was far different politically from the situation here in the United States. Jerry Friedman, however, disagrees and goes on to, he and his colleagues, disagree, and they go on to say, in 1947, the province of Saskatchewan pioneered the implementation of a universal healthcare system over the fierce opposition of the medical industry, many doctors, and right-wing coalitions, in a landscape that very much mirrors the contemporary polarization in the United States. So their contention is directly opposed to a lot of the critics we've seen who insist that our situation here in the United States now is not at all like the Canadian situation. Going further, though, Saskatchewan's success, I'm quoting again from the article, the successes of Saskatchewan's single-payer system, which included low costs, high-quality care, and expanded access to care, were praised by activists around the country, including, quote, labor and farm organizations, consumer groups, community associations, and many churches, unquote. And quote again, finding that Saskatchewan's system was superior in every way to Canada's prevailing private health insurance scheme, national figures formed the political coalitions that they would need to pass a national, universal healthcare plan that emulated Saskatchewan's on December 8th in 1966, less than 2 decades after the latter's enactment, unquote. Okay, so I want to point out here that, of course, they're stating this as though it's something very favorable. And of course, compared to the performance of the United States in this period, it is very favorable. But when we look back at it, at this point, it was 19 years before they made it province by province through Canada. We can't afford to take that time. We have to do it as quickly as we can, but surely in 5 years, we have to have a national Medicare plan in law. Certainly, if it's any longer than 5 years, it's going to be an awful failure. That's just my comment, though, on it. Some critics, like Tim Faust in Health Justice Now, Single Payer and What Comes Next, argue the need for federal approval poses an insurmountable barrier to the success of any state-based single-payer system. The barriers are not as insurmountable say the authors, okay, as assumed to be, and a narrow focus on them obscures the real benefits that would accrue to working class people under a state-based single-payer system. And quote again, for instance, Faust's concern that the executive branch would need to approve the state's the Medicaid and Medicare waivers to adjust its allocation of federal funds to the state payer ignores the rules governing such waivers, as a state-based single payer could simply register under Medicare Part C. Okay, now this is an idea which is very frequently cited by Friedman, who is saying, in more commonsensical, okay, recognizable terms, the state-based single-payer agency could register as an intermediary under the Medicare Advantage plan. And for Medicare participants, could essentially function like some organizations such as Kaiser, okay, or United Health, or any of the other types of organizations that are now functioning as vendors in the Medicare Advantage program. Why is this good? Because they wouldn't be like any other Medicare Advantage vendors. That is, they could come in as a nonprofit trying to minimize administrative costs, drug costs, all the other costs that exist. And even though they wouldn't be allowed to drive the other Medicare Advantage places out of business by law, they could easily compete with them and drive them out of business at the state level in Washington. So that was the concept, okay, in back of this. Okay, and according to Friedman and the people, okay, in Washington, it is much easier to enter and become a Medicare Advantage provider than it is to get the waiver approvals from the administration, okay, in Washington. Quote again, under the current Biden administration, waiver approval may be less of a concern. Health and Human Services Secretary Xavier Becerra has endorsed single-payer healthcare in the past, and while he's cooled on the idea since, we may expect that he will allow states scope to experiment. Now, Faust is also concerned about getting past the ERISA law, which says that states are not allowed to prohibit employers from offering health insurance to workers. But, quoting from the article again, however, there is no need to compel employer participation. States do not need to prohibit employers from offering health insurance to workers should they insist on wasting money on a redundant service. Regardless of what employers do, taxes will be collected to fund the program, and health care will be provided free at the point of service, but to all. So again, the implication here is the private services will begin to disappear over time because people in general will be entitled to health service but for free, or very close to free anyway, certainly free at the point of service. And so it's going to be very hard for the Medicare Advantage providers to compete with that. So the expectation in Washington is that they are likely to disappear over a short time. So one way to think about this is that with the state agency acting as something like a Medicare Advantage vendor, there will be in the states, okay, a public option which people can take advantage of and will be much more lower cost than the private options, okay, that are available. Finally, I'm quoting again, Faust is concerned with the issue of spending. And I remark, this is the fiscal sustainability problem. Unlike the federal government, states aren't allowed to deficit spend, quote unquote. The single payer would need to be paid in full every year, probably through a consolidated tax on employers and employees. The problem is, I'm sorry, I shifted down. I shouldn't have done that. The problem is that in years of economic downturn, state governments could find themselves forced to choose between cutting health care or reallocating funds from other areas of the budget, such as education. This is a real problem and another good reason why we need to keep working on a national program. Nonetheless, says Friedman and his colleagues, it's not an insurmountable barrier, unquote. And then they explain why. Quote, states can avoid cutting health care in an economic downturn in the same way private health insurers prepare for financial troubles. I might add here, not just private health insurance, but the way all private sector actors, including ourselves, act. We accumulate savings. We accumulate the reserves in advance, to go back to the quote. The state-based single payer would run surpluses in the good years, so reserves could be used to buffer against potential revenue decreases in the bad years. Of course, a very simple idea. But, for example, Jerry Friedman's economic analysis and the projection from that analysis for 2021 showed that under the whole Washington plan, there is a projected surplus of $12.2 billion accumulated in 1 year. If that had occurred, that would have been enough to pay for 60% of Washington's projected tax contribution for 2022. It would have been that much of a surplus. Even if there was a downturn in Washington in 2022, there wouldn't have been a downturn sufficient to erase that surplus of 60%. So in the first year of operation, the level of the surplus would have been enough to protect the state if 2022 came up with a bad year, and a very bad year. In other words, even a downturn of 5% would not affect things, or a downturn of 10%, okay,
30%,
even 30%, even 40%, even 50% could be managed, and there would never be 50%. And in a minute,
wouldn't happen.
Yes, but we'll see exactly why in just a minute. Okay, when we get to how it's paid for. But first, let's just note, the plan covers the medically necessary care, including hospitalization, doctor visits, dental, vision, hearing, but mental/behavioral health, also prescribed occupational and physical therapy, prescription drugs, medical devices, and rehabilitative care. So basically, everything a person would need and everything which is available or would be available under federal single payer, such as H.R. 1976, which is the Theobald bill that's currently the standard, okay, for Medicare for all. So what are the economics of the whole Washington plan. First of all, it calls for the establishment of a health trust, the whole Washington Health Trust, as a state agency that would accumulate reserves and make disbursements to providers for healthcare. Okay, the WW single payer plan would save about 33% per year compared to what was expected to be the projection for 2021 for the present system. Okay, that projection was at close to $98 billion. Okay, but if you do the projection for the whole Washington plan, the expenditure was going to be cut down to $67.2 billion. So that's a drop of 33%. Of that remaining figure of $67.2 billion, 69.5%, or $46.7 billion, would be covered by funds from federal sources or other remaining sources. The remaining 30.5%, or $20.5 billion, would be funded by state taxes from Washington. So out of the original nearly $100 billion, Washington, if it had adapted that single payer proposal for 2021, would only have to have covered $20.5 billion with an increase in taxes. As we'll see in just a moment, that would have been a very good deal for all concerned. Now, of course, the surplus of $12.2 billion also have to have been covered by the state taxes. Okay, which of course is the protection, the fiscal sustainability of the program. Now, there was a tax plan, okay, which was developed by Friedman, and we'll see in just a minute what the figures are for that particular tax plan. But first, let's go through the existing sources of funds for the whole Washington Health Trust and the remaining out-of-pocket expenses, which would have taken place in 2021 had they adopted the plan. Okay, Medicare, through their going the Medicare Advantage route, would have provided $17.2 billion. The Medicaid funds from the federal government would have provided $17 billion. Now, I have to mention here that the reason why it would be very easy for Washington to get a hold of the Medicare funds is because under the Medicare program, the state of Washington is a fiduciary for Medicaid anyway. So they're charged, okay, with the administration, actually executing the Medicaid program in the states. So they can claim the $17.0 billion for their plan to execute, okay, and improve Medicaid, and they don't need a waiver for that. Okay, because as the administrator, they have the flexibility. And if New Jersey were to do something like that, then New Jersey would also have the flexibility. Okay, because it is the administrator, okay, of the Medicaid program.
The question, can I ask a question at this point, or should?
Absolutely. Please ask the question.
The question that comes to my mind is, what if all 50 states did this? Are the funds And that would be great if they did, but are the federal funds available for all 50 states to do it?
Yes, I believe the federal funds are available for all 50 states to do it, because these are the funds
Mhm.
that were projected for 2000, okay, and 22. This was only the state of Washington's share
Mm.
that they were going in some, that was going in some form to be spent in those states anyway.
Mhm.
Okay.
Okay.
So there's no question of additional funds for this. In fact, there would be more likely to be additional funds if the present system were followed, because the Medicare Advantage providers have ways of actually looting the Medicare trust fund. What they essentially do is they upcode the bills that they send to the federal government.
Mhm.
And when they upcode those bills, they more rapidly drain the Medicare trust fund. They've actually been doing that for years, and they're going to continue to do that. Okay, but if Washington were to basically take over the Medicare Advantage program for the whole state, uh, they would not be doing that kind, okay, of upcoding, because the whole Washington Health Trust is a state agency. It's a nonprofit agency of the state, and it doesn't have the same kind of incentive to increase profits and loot the trust fund as the private vendors have. Okay, okay, so then there's the S-chip program for kids. Washington's share of that was $2 billion. And this would be there for them to tie into also. Okay, then there's the VA funding. Of course, the VA funding would not be available to Washington, but it is a source of funds that would be spent in that state, simply as a matter, okay, of the projection. It would be the federal government, okay, that would be directly spending it, but this is not a consequence, okay, for Washington, okay, in terms of the economics of it. It's only listed here simply to show that these are sources of funds to be spent inside the state. Okay, then there's another category, the other category, that was $7.1 billion. The other category includes state and local public health, workplace health care, Indian Health Service, charitable contributions, and others. The medical spending through workers' comp, homeowners, and auto insurance has been removed but from this particular calculation. Okay, now I have to add here, Washington State had already budgeted for 2021 and 2022 roughly $12 billion a year for the healthcare authority and for other healthcare expenses in the state, some of which, okay, are covered in this category, okay, of other expenses. Certain other things that are covered in the category, like the Indian Health Service, it's doubtful the state could actually get control of that, but those funds would be spent inside of the state anyway. And so they're included in this analysis. Okay, now the out-of-pocket expenses, okay, would occur because it's calculated that some people would not want to tie into the WWHT plan, that they would stay outside and they would have the out-of-pocket expenses they have now. And so this would amount to costs of $2.7 billion that would not be contributing to the savings of the trust, but would be spent, okay, in any case. However, the state should get some ACA subsidies,
Mm.
due to them, and that would be roughly $600 million, about 0.6 billion. Okay, so this totals 46.7 billion out of the 67.2 billion or something like that, that would be spent by other sources in the state or coming from federal funds that would be turned over to the state. So from the 67.2, you have to subtract the 46.7, which leaves a gap of $20.5 billion still to be covered. So how is that covered? Here are the existing sources of funds before the trust. Oh, I should have changed this particular title here. I forgot to do that. 8.5%, okay, employer payroll tax. But that was projected to raise $23.3 billion. Okay, notice this one item alone covers the $20.5 billion gap and still leaves a small surplus.
Mm-hmm.
Just this one item. Then there was a 2% employee payroll tax at $5.5 billion. So together, these, which was going to be 16.8% of the total raised. So this totals up, those two items total up to 88.1%. Okay, and in billions of dollars, they total up to, what is it, $0.8 billion. So the gap, we recall, was $20.5 billion. So $28.8 billion, that's an $8.3 billion surplus right there, just from those two items. That would be a pretty healthy surplus actually by itself. Unlikely, very unlikely to be erased by extremely bad times in 2022. So in the first year, even those two items show that you'd be having a fiscally sustainable program. Now, they also specified a 2.0% sole proprietor tax on net income, okay, above a certain amount. I think there's I think it's on at net income above 15,000, okay, in proprietors. Okay, so there's an exemption for the first 15,000 or so, okay, of profit. But that's only a 2% tax on that. And it's not really that important but for the financial plan because it would only raise about $800 million. I'm sorry, did I say $800 million? No, I think what I meant to say was that it was only going to raise $0.8 million, $800,000 in other words. 0.0%. 0.0% of the total. That's all it was going to raise. It doesn't make sense to me for them to have this particular tax. It's a nuisance tax. Okay, it wouldn't be a burden on the proprietors, but they'd probably resent it. And there's no fiscal reason to have it in there.
I think, though, Joe, I'm not absolutely positive, but the Constitution mandates an equitable taxation across the board. Mm-hmm. And I think it was one of those things, I'm not positive, but for it to be that de minimis and still be in here, I think that's part of it. I think that's why it's here.
Yes, I do agree, Lisa. Okay, I remember reading that they were trying to develop a tax plan that would involve some burden, okay, for everyone.
Mm-hmm.
And
I
that is
think that's a good
probably
idea.
why they included it in here.
So this wouldn't be a new tax at all, though. This would be an existing one.
No, the 2.0% sole proprietor tax would be a new tax in the state of Washington. Okay, it does not exist now.
Okay.
Okay, so for them, okay, it would have been a new tax.
Mhm.
Then there was also an 8.5% capital gains tax.
Mm.
Okay, I guess that's a tax, on individuals who have a capital gain. That was projected at $3.0 billion. That's 9.2%, of the total. Okay, the next part of the funding plan was $200 a month the premium for those above the age of 19 and above 200% of the federal poverty line. That was $900 million. That is $0.9 billion and 2.7%. So from a fiscal point of view, again, they could take away the premiums,
Mm.
okay, and they could take away the sole proprietor tax, and it would do very little to lower the amount of money they raise. It would do very little to lower the total revenue projected of $32.7 billion. And again, the revenue required for 2021 would have been $20.5 billion. And so subtracting one from the other, that's where the surplus of $12.2 billion, it's actually $12.227 billion, actually comes from. Okay, so that was the plan. Now, it's important to focus on the payroll tax for the employers. It was estimated that in Washington, but those employers who cover their employees with a health care plan are averaging 15 to 20%, of payroll. In some other states like California, it's higher. It's more like 18 to 25%.
The
But
percentage of healthcare costs to the employer.
Yes, the percentage of healthcare costs, right, to the employer. Okay, for Washington, it was estimated between 15% and 20%. And I think they said that it was going to average, be an average, of 18% actually in Washington, or something like that, or a median of 18%. So the 8.5% employer payroll tax would actually be a reduction of 50% of what they're paying now.
Mhm.
Right?
More
But
than.
that's a deal for them.
Yeah.
Okay, then the employee payroll tax, of 2%, that's also a deal considering what they're paying now in terms of contributions to health plans, or other things. Okay, in fact, in cases where the employer was taking over the whole contribution to healthcare and not charging the employees anything, then the employer would still have a good deal, even though it would cost them 10.5%. If they were going in at 20% before, it would still be a savings of 50% for them. Okay, but where that's not happening, the 2%, employee payroll is still a very, very minor cost for them. And what are they getting for that? They're getting no copays, no deductibles, a small premium, relatively small premium compared to market, and they're getting everything covered, okay, entirely covered, except in rare cases of certain prescription drugs, they would have to make very small copays, but those would be limited to a total of $200 per year.
Hmm.
This is supposedly only in the case of a very few very expensive drugs. So it seems to me that's a very good deal for the employers. It's a very good deal also for the employees.
Oh, yes.
They're getting much improved health care, and the risk is getting removed. The risk of bankruptcy, the risk of divorce based on the financial hardship, the risk of mortgage foreclosures, all those things are gone. And that's what this is doing for people.
And as someone who has been using the Affordable Care Act since its inception in 2009, I guess, or 2010, all I know is that even though the premiums are lower than they used to be and the subsidies are coming in, it's not insurance at all, because
No.
the out-of-pocket expenses that are allowed, the deductibles that you take on, there's I'm not getting I'm getting very, very little for the money. And so when you're talking about cost savings and an increase in coverage, you're really talking about a lot of benefits from this.
Yeah, you're talking about a tremendous amount of benefit, but I think from my point of view, the most important thing is the removal of the risk.
Mm.
I'm talking about now the financial risk.
Mm-hmm.
Just not having that a part of your life anymore, and just knowing that you're entitled to this health care, for this relatively small cost. Okay, and by the way, if you're poor, okay, and you don't have a job, okay, or you've lost your job, there's no insecurity associated with that.
Right.
It's the same. You still get covered by the plan. So there's just a world of difference with it. And it looks like it would be very easy to implement, but from the financial point of view, it looks like it would be very fiscally sustainable. Okay, so I'm going to stop sharing this, okay, at this point. I think I remember most of the details by now anyway, if we have to refer to it again. And would it be useful to you, Madelyn, if we went over the frequently asked the questions that whole Washington, okay, has put up?
Yes, maybe it would help too if I just ask. I have a couple of questions to be sure that they're answered.
Shoot.
So one, you just raised one of them, and that is the connection between a job and health insurance, because you were talking about employers and employees contributing into the fund, but they are not the only contributors to the fund. So even if you're not employed, how does that work? How does your coverage work if you're not employed and you're not paying into the system, that percentage that you discussed of a few minutes ago?
It has nothing to do with your payments into the system. In other words, the payments in the system have nothing to do with your entitlement, but the coverage. All the residents of the state, okay, are entitled to coverage, regardless of age and regardless of financial contribution that they have made to the plan. It is a universal health care plan, okay, in that sense. It is almost completely free at the point of service, except for those very small copays for the very rare prescription drugs. Okay, so I mean, it's truly just, you go there, okay, and you get health care. there's a card, and you show the card. All residents, okay, will have the card, and you get your service. Okay, and really the only way for doctors to make money in the state in that situation is going to be for them to accept people who are covered under the plan, okay, because everybody, okay, is covered under the plan. Okay. Also, by the way, okay, I should mention that it's part of the design of the plan that it will not be paying Medicaid rates to the providers. It will be paying Medicare rates to the providers. Okay. And as we know, the Medicare rates are largely acceptable to doctors, okay, to most doctors. We don't see there's much chance of doctors actually moving out of the state, okay, and going to other states, because doctors will have tremendous savings in paperwork and administrative costs from their participation in this plan. But this is covered in the frequently asked questions. So let's go over those. And I think some other questions that might occur to you,
Okay.
that could be answered.
Okay.
Okay, we've covered what is the employer's contribution and what is the payroll deduction from the employee. We covered that already. What is the self-employment contribution? I'll make sure we covered all of that. The exemption is $15,000 minus the adjusted net earnings times 0.25. So that's the tax. The exemption would not apply for net earnings above $60,000. Okay, and the self-employment contribution is 2% of the adjusted net earnings. So then they give a calculation example here for it. I'm not going to go through the calculation example for that one. I don't think we need to spend time on that. Then there's an investment profit contribution, okay, as well. That's the capital gains tax. Okay, we talked about they have some exemptions here. That tax won't apply to residential or home sales. It won't apply to agriculture income. It won't apply to retirement accounts. Okay. So it's long-term capital gains. And the exemption does not come into play for any long-term capital gains above $60,000. If the long-term capital gain is $15,000 or less, the tax is not applied at all. And then there's a calculation example here. Okay, and again, I won't go through the calculation example. There's an explanation of what is single payer here. Refers to a publicly financed system with universal coverage for all medically necessary care. Healthcare is financed by one entity or one payer. In this case, the whole Washington Health Trust would pay the medical expenses for all enrolled Washingtonians. The healthcare delivery would remain largely in private hands. Okay, so in other words, this is a socialized insurance system. It's not a socialized medical system. Our current system is a multi-payer system. It's made up of multiple private insurance companies and multiple governmental programs. So this would not be a multi-payer system. It would be a single-payer system. But is it a true single-payer system? Now, the PNHP people make much of what a true single-payer system is. And so what they say here is the whole Washington Health Trust program is as close to single payer as a bill can get on the state level. So they're acknowledging that no, by the PNHP standards, it's not a single payer system, but it's as close to single payer as possible. Due to federal laws regarding Medicaid and Medicare and ERISA and VA and the Indian Health Service, we need waivers to hold everyone into one system. However, the initiative writing committee, along with Dr. Gerald Friedman, came up with a brilliant workaround, allow anyone on those programs to opt into the WWHT. Much less expensive, more comprehensive plan will attract individuals and businesses alike, making private insurance superfluous. And that was the Medicare Advantage business that I was talking about before. Will this new system save Washington residents money? And this refers to Gerald Friedman's earlier study for 2019. The figures I was reading to you came from his update in 2021. I don't have the final update yet because it's still to be published. I've seen a draft of it though, and I was giving you the figures from that particular draft. So this points out that in 2019, $9 billion in healthcare costs for Washington state residents would have been saved. Okay. Of course, what they're talking about here, I think, was the surplus. Okay. For 2021, that surplus has risen to 12.27. Okay. There are projections for 2022, okay, and beyond. The surplus rises each year. Over a period of 10 years, the surplus amounts to $150 billion. I don't doubt that this is realistic. I think that once the surpluses get extremely high in terms of the accumulated reserves, I'm sure the state will want to tap into those surpluses. But that's all right. Because from the point of view of the WWHT, once they get to a surplus that's going to cover a full year gap, they're covered against anything that might happen. And, I'm sure that if the state wants to tap into, let's say, 50% of the $150 billion, they accumulate over 10 years, it's not going to cause a problem for the program.
I got a question on that, real quick.
Yes.
Go ahead.
If not, Washington state aside, right? If you start running major surpluses, coming from a person who I was in healthcare for 10 years and finance director, had my hands in operations because finance has to have their hands in operations. You have to understand what's going on. If it were to materialize, because this is real, that you don't have enough providers of a certain type or enough providers in a certain area, right? If you've got surpluses like that in the plan, could you stipulate that those surpluses would be utilized to ensure that there were enough providers, that if you needed doctors, whatever you needed to do to bolster the public health service is what I see this as, right? The state is going to provide public health again, which is what we don't have now. Could you stipulate it so that those funds were utilized for that, so that it doesn't get taken away? And yet, oh, wow, we've got this rural area over here and they don't have any providers and people are getting shipped an hour away to a hospital kind of thing.
From my point of view, I don't think they would have to stipulate it, simply because the managers, okay, of the WWHT have controlled the surplus. Okay, if they believe that they need to do something to increase the numbers, okay, or the quality of the providers in the state, then I think they're certainly free to spend a part of the surplus, okay, for that. Now, there's a surplus is only, okay, a projection by an economist, as to what would happen if the current kinds of expenditures stayed the same, and the current costs, were to increase at some anticipated rate. But if the costs were to go up because whole Washington had a need to spend more on certain aspects, I'm sure that whole Washington would be able to spend more on those aspects.
But
But as a state agency, they would be under the scrutiny of the healthcare authority in Washington. So if they started to spend, in a unjustifiable way, I'm sure the healthcare authority in the state, would intervene, in that case.
But what Lisa said is something that, or asked about, was something I was concerned about, because we all know from Social Security, for example, on a national level, that the trust fund for that was supposed to be untouchable. And the federal government, both Democrats and Republicans, took out so much that the taxpayers, or the federal government, that is, owes like $3 trillion back to Social Security, that Social Security may never see. So I'm
Okay, let me tell you a secret about that.
yeah, okay.
Yeah, this is amazing. Wait till you hear this, Marilyn.
Or a
Yeah.
not so secret about that.
Mm-hmm.
The Social Security surplus, the so-called trust fund,
Mm-hmm.
was never in a bank anywhere.
Mm-hmm.
It was never a bank account. Okay, so it was never a trust fund. It's called a trust fund, in quotes,
Mm-hmm.
but it's just an accounting record of what is due to the Social Security Administration. But it was always set up so that there were the FICA contributions that were coming into the federal government. They were always coming into the Treasury, and the Treasury was always free to use them for whatever the Treasury's purposes are. And all they've had to legally do is keep an accounting record. However, they are obligated. It's a debt of the Treasury Department
Mm-hmm.
to the Social Security Administration to use what is owed to Social Security when it's necessary to spend that money. The Treasury Department is going to have to spend for the Social Security benefits that are due to people.
Right.
But let me tell you another secret.
Okay.
The other secret is that it doesn't matter a damn if the Social Security Trust Fund actually falls to zero. Why doesn't it matter a damn? Because it is always up to Congress to appropriate
Mm-hmm.
Social Security funds.
Mm-hmm.
If Congress doesn't appropriate the Social Security funds, those checks don't flow. It doesn't matter what's in the trust fund. There could be $3 trillion in the trust fund if Congress decides, hey, this year we're not going to appropriate
Mm-hmm.
Social Security funds, then nobody gets paid. On the other hand, if that trust fund happens to be zero, if Congress decides to appropriate it anyway, then guess what? It repeals the previous law that said that Congress can't pay out Social Security benefits if the trust fund falls to zero. In other words, in the end, it is always up to Congress. And there are lots of things that Congress can do to afford to pay the Social Security benefits out. For example, it could always mint a platinum coin each year to cover all the Social Security payout. They know exactly what it's going to be. And platinum coins, of course, can be given a discretionary value by the Secretary of the Treasury. In other words, you could mint a platinum coin for $2.2 trillion if you wanted to. You could mint a platinum coin for $100 trillion if you wanted it to, deposit it, at the Federal Reserve. It's all perfectly legal. And you would get $100 trillion in the Treasury spending account.
So
Treasury would
So
not be able to spend all that. It can only spend what Congress appropriates.
And
And
become,
only
bringing it back, I'm going to bring it back to Washington and
Jersey.
the healthcare for all.
yes, we'll come back to Washington now.
Well, no, but I mean, my point with all that was solely to say that if there was no stipulation about how that surplus money could be used, that it might wind up being used to pay for other kinds of things, ultimately draining the funds that draining the surplus, so that for the next year, if it was a bad year, there wouldn't be enough to cover all the costs.
Okay, as I understand it, in the Washington setup for the WWHP, HT, this would be a real trust fund. I asked Cindy Jacobs that question, by the way, when she was on my show.
Mm-hmm.
She stated, okay, and she was one of those who wrote the law, okay, the initiative law. She stated that surplus would be in a bank account in the whole Washington Health Trust's bank account. So that is the intention. That is what is specified in the law, according to Cindy Davis. But anyway, regardless of whether that holds for Washington or doesn't hold for Washington, it could certainly be specified in very plain terms for New Jersey, couldn't it?
Mm-hmm. Mm-hmm.
That surplus.
Everybody else, hands off.
Right. That was my concern, because, when you get into the states, I mean, I'm in Pennsylvania, so I think it is a very real concern as to when you have that kind of surplus, that you can stipulate exactly how it needs to be spent and trust that up, almost like with the same kind of thing that happens upon someone's death. A blind trust is created, and there are very specific stipulations around how you spend that money, who gets to spend it, what it gets to be spent for, yada, 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 yada. And making sure that that money cannot be diverted, or, somebody could say, hey, we don't have enough money, we've got to come in and take money out of the trust. You stipulate that, right? If there is a catastrophic situation and you've got $200 billion sitting over in the trust fund that you might not need, right? Then you have an emergency valve. But in the interim, surpluses that run like that in states, I would want to know that you've got that safety in there, that, it's going to go for this, it's going to go for this. If we're going to take some of that surplus and endow a medical school, to make sure, there's a lot of things that come in with public health, making sure you have distribution centers for vaccinations or whatever it is, right? Because we all are very much aware that our public health system is busted. So that's kind of where I'm looking at this, because it's not the federal level at that point, right? You're getting the funding, but you're in the state now, you're in the user category, right? Which is everybody in, a lot of circles, that this has been the criticism, the states are users. Well, okay, yes, we are. We got a surplus problem. We need to put some stipulation around it. How are we going to spend it, right? Mm-hmm. Which, hello, strike three, woohoo, that whole idea is out of the way. The problem is, how do we make sure we spend the surplus the correct way?
Yes.
And, all of that, planning that, what's that look like, that kind of thing.
And I guess what we're getting at, and what this discussion in the last couple of minutes, is that each state could handle that part of it differently.
Yes, they could.
Each governor could, or legislature, but governor, with the final say, hopefully, or, veto power or whatever it is, to try to make sure that any surplus serves the people, continues to serve the people, not anybody who wants to put their hands in it for whatever purpose.
And what's coming to mind now too is like, okay, so you've got this healthcare trust, and you're rebuilding public health.
Mm.
So I'm envisioning now, and just going at it from my standpoint, like, who are you working with? You'd be working with the health department, right? I mean, there would be a whole new infrastructure that's going to come back into play in the state. You're building public health again. And I mean, this has been my concern for the last 10 years, that more than 10 years, but the 10 years that I was actually in healthcare, is you've got to have public trust to have public health, right?
Yes.
And the insurance environment has decimated that. We don't need any more proof. We don't have the trust. They don't know how to operate it.
Mm.
But I see rebuilding that trust at a state by state level, with the state governments able to have input and say in that, right? Without it coming from on high,
Right.
imposed upon them, right?
Right.
Without them having say, without them having been able to prepare. And I just think that this is really a golden opportunity. There's no governor that really, truly, there should not be a governor. Well, there might be, but okay, let's just be honest. But truthfully, if you can take care of all of your people,
Right.
okay, and save small business. I mean, come on. Small businesses are going to win here. The
Yes.
people aren't going to be tied to their employment to get their health care anymore. As long as you can shore up and keep intact the providers and, access to providers, and access isn't a dirty word anymore. Now access just literally means there's enough doctors for you to go to, right? I don't see how you lose here. You're saving money. You're
Well,
helping small business. You're rebuilding public health.
you
can
lose
up all of it.
You lose the support potentially of these uh, mega $1 million insurance companies, private insurance companies, who, by the way, yelled and screamed about the Affordable Care Act, even though that was a windfall for them. So, they really, I would call them the industries who cry wolf, because, unless they can make their mega profit, they're not happy. But I'll tell you, I mean, for years now, I've thought that all these kinds of insurance, it's not insurance at all. It's a one way. You put the money in, your money goes down, the tunnel, into some deep dark hole that you can't see. And the minute you need it, your premiums go up, everything goes up. So what kind of you pay and pay and pay and pay for years and years and years, and you can't use it if you need it. That's not insurance. So this kind of setup is insurance. I mean, you're not going to. There's no argument or debate about pre-existing conditions. There's no argument or debate about what kinds of treatment are available, right? I mean, so this is insurance. This is health insurance.
Yeah, and it's in a partnership with the people,
Mm-hmm.
the employers, and the state government. All of it, right? If it's done well, done right, written well, you have to bring everybody to the table.
Yes.
The only pieces of this puzzle that, like, because I was in healthcare and we had operations across the state, right? I'm not sure, like, what do you do with the mega machines that are vertically integrated, like the MCOs, right? How does that work? I mean, there's some work that is going to have to be done here about the transition, because those doctors are literally contracted with those entities. They've signed their billing rights over to them. Okay. So there are mechanisms within healthcare. You're going to have to figure that out. How is that transition going to work? Because the doctors are contracted with the damn health insurance entities. They own their asses, basically. Excuse my mouth, but that's what's going on.
Well,
Nothing happens in healthcare without a doctor's signature. And the only way that a insurance run facility can bill under a doctor, bill for services, they have to be able to bill for that doctor. That's why they have to sign those contracts. Then that entity can bill, right, for them, as opposed to a private practice that has a group of doctors that will take anybody's insurance. They aren't part of a monster. They're paying their own rent. They're paying their own insurance. What do you call it? Malpractice insurance, right? They're covering themselves like the doctor's offices of old. They get to practice medicine for real. They're more apt to go and fight the insurance company to be able to override denials because they are not working in that machine. So there's more here that has to be flushed out in states that have those monolithic, vertically integrated systems. Not all states do.
I
Okay.
think New Jersey is one of those states that do, though.
What do you have there?
What insurance companies?
What big like
Prudential,
Pinnacle?
Blue Cross, Blue Shield.
Yeah, but they're not an MCO though. They go ACO usually, accountable care.
I don't know I'm not aware. I don't know what the difference is.
Well, like you've heard of Kaiser Permanente, right? The monster that is out of California.
Right.
They have that, they've got their own doctors, they've got their own facilities, all hospitals, everything. And they all work for Kaiser, as opposed to, at least here, some of the Blue Cross Blue Shield, the doctors, how do I want to put this? The doctors go and they work within, but they still will take more than one insurance. How's that?
I see.
Okay. Kaiser is Kaiser. You go into Kaiser because you are a Kaiser beneficiary, right? Whereas an ACO will take other insurance plans. Okay. Along with usually the insurance plan that they are named under. Okay. And that's kind of the difference. So I think it's a little bit easier to go at it from that angle as opposed to trying to take apart a Kaiser.
Yeah, I don't know then if we have what we have in New Jersey that's like that. I know we have the large private insurance companies, but I don't think we have like the community of Kaiser.
Right.
The separate area code or zip code for Kaiser, where everything is
exactly.
I don't know that we have that, but we still have powerful insurance companies.
And they're going to fight at you tooth and nail, right?
Yeah, and I think when I was running for U.S. Senate and I was raising this issue of single payer, the only people who oppose it are people who are inside the healthcare industry, who are profiting or making their living from within that industry, and they see they're terrified that they'll lose their lifeline, and that would have to be addressed. Certainly, we don't want people thrown out of work, but then it can't hold everyone else hostage to that either.
Well, that again, right? You've got Bernie's plan had a transition for employment, right? People who would have to convert over. I don't think that conversion is going to hit as hard. Well, okay. It's going to hit insurance. It's going to hit the insurance end, the insurance salesmen, the brokers, all of that kind of thing. That they're going to get hit hard. Okay, well, they've been making money hand over fist for how damn long already, right?
Yeah.
The people that you really want to worry about are the people that are doing the billing and, finance officer in healthcare. the billers aren't making anything. The longevity of being a medical biller, I think the average is 2 years.
Mm.
The turnover is 2 years because it's so hard now. It is a monster. You can, but you're still going to need to retain people who know how to code and how to bill. Okay.
Mm.
So I see ways to do this that would work. I'm more looking at, Washington, they've got 8 million people in the state, right? How many you got in Jersey? I mean, we're talking a lot more people in a small, you know what I mean? So it's different. Every state's going to be different.
Yes.
But I just really see that when people start understanding that this is actually not only possible, it's doable, but it's going to take the desire to reinstitute public health. It's going to take a desire to want to fix this, to save the small businesses money, to see the value in all of that, right? And those are, I think, in my opinion, they're easy to sell. It's easy to show the small business how they would save money. It's easy to let people already know they're sick, and look at the strikes that are going on.
Oh,
They're
yes.
sick and tired of having their health care tied to their employment. And for 35 years, nobody's wages are going anywhere. And the big excuse is because it's your health care while they're robbing 20% of your take-home pay in your damn premiums, copays, and give me a break.
Yeah.
Doesn't
No,
work anymore.
No, I think those kinds of arguments are if there was a climate, a political climate, political environment where that kind of conversation could be had, I don't think it would take too long to convince or persuade people that it's best for them. And also during this pandemic, it was like 14 million people who lost their health insurance immediately when they lost their jobs. So I think benefits and the need for them and the cost savings of those benefits are easy to sell. As you said, the Affordable Care Act, it was never what it was sold as. It never was.
No, it never was. It was a swindle.
But
It's an
yeah,
absolute
yeah,
swindle.
yeah. It was.
But by the way, the population of New Jersey is roughly 8.9 million people.
Oh, really? It's only okay.
I was gonna
Okay.
say,
Okay,
yeah,
so it's a
But they got
little
the
larger
pharmaceutical
than
industry
Washington,
sitting there.
okay, in population.
it's what? Sorry, about equivalent. Yeah.
Yeah, it's about equivalent. But you have a big pharmaceutical industry sitting
Well,
in Jersey.
That's what. Yeah, we have a lot of corporate headquarters. And so that would be a challenge. But again, I think really that the last 19 months of living through this pandemic has impressed upon many people what the weaknesses, flaws, injustices of our current system, our current capitalist healthcare system, if you will, where
Mm-hmm.
it's all about profit. And there are people who were making choices to go back to work in very bad working conditions in order to draw a paycheck or to stay home where they could take care of their health but have no income. These kinds of choices are just,
Barbaric.
they're wrong.
They're
Nobody should have to make
No.
that choice. Mhm.
Well, so in anything like this, right, you got to get the people behind you.
Mhm.
And I think the environment to get the people behind any effort like this is there.
Mhm.
Getting that message out. How do you sell it? I don't necessarily think you need to do things like this through a campaign for office. It's obviously a great opportunity,
Of course.
right?
Not.
But it's putting the messaging together and getting that messaging out there. And your healthcare, your nurses are going to want this. any frontline doctor is going to want this.
Mhm.
Okay. The only institutional people that are going to be against it are the ones that are on the take, getting the kickbacks, right? And that's okay, because ye are the many, they are the few, right? It's a numbers game. And I just cannot believe that there will ever be a time where the American people are going to be so open to something like this.
And we are, the Green Party, in my candidacy, we're the only candidate for governor who are talking about, of all the candidates, we're the only ones talking about Medicare, improved and expanded Medicare for all. I'm getting a better idea now of the difference between that and a single payer health plan. Um, I sometimes use those words interchangeably when I shouldn't. But we're still the only candidate talking about that. Murphy he goes with Biden on tweaking the Affordable Care Act. Chitterelli, I haven't heard boo on that. I assume it's all private industry funded, and doesn't want to touch this with a 10-foot pole. And I know too that there are a lot of organizations in New Jersey who have been fighting for this improved and expanded Medicare for all. We had this conversation, Joe, the other night. There is a split, though. I mean, some who think we have to wait until the federal government steps forward to implement this kind of plan, and others who say, well, if we're going to wait for the federal government, we're going to be waiting for eons and eons. So we have to start with what we can do. And
Yeah, we could be waiting if we still have elections that mean anything.
Yeah, seriously.
Could be waiting until 2029. Okay, and if by then we've been totally converted to fascism, it may be way beyond 2029 until that regime is overthrown.
yeah.
So that's what we're looking forward to. So it seems to me that running campaigns at the state level for single payer right now is very important for a number of reasons, including helping to change national politics.
Yes.
So people see that things are getting done at the state level. They can be done at the state level. How are they going to be gotten done at the state level? Only through organizing at the state level, running major bottom-up campaigns at the state level. But once we show those are possible to run at the state level, those same campaigns are going to spread to the national level, and that's going to run counter to the fascist trends that we're seeing right now.
Well, and let me just jump in here, because there's another element here that I'm worried about. Obviously, we're worried about totalitarian mess that we could be walking right into. But we've got something else to worry about right now, which is climate. And we are very quickly going to start seeing large swaths of the population that are going to be displaced and needing to be relocated, right? And once we get into that, I really don't believe at that point, when we start seeing major catastrophes where we have to relocate masses of our own people, right? I don't think we're going to see a federal program at that point. I really just don't. I think the federal government is going to have, I just don't think it's going to happen. I don't. I might be wrong, but I just
don't think that the federal government is going to rise to the challenge of doing anything about the climate emergency.
Well, I think that they are going to have so much on their plate at that point. We're going to be looking at mass FEMA things going on. And once you've got a population that is that compromised, do you really think they're just going to stroke the pen and say, here, Medicare for all?
What I think is likely to happen is that It's a terrible situation with the two-party system. Because we have a Democratic Party that is run by the neoliberals, who obviously don't care about what's happening to people. Sometimes they make a show of caring, but they're unwilling to do the things that are necessary to do. To understand this, all you have to do is to look at what happened in New Zealand and Australia in relation to their responses to COVID and compare it to our responses to COVID. We, as a people, just didn't do what was necessary. Part of that was due to Trump's leadership, but now we see Biden taking over, and he too is unwilling to do the things that are necessary.
But that's all corporate money. Forget the red and the blue.
Okay,
it's all corporate. It doesn't even matter.
I'm not trying to make a red and blue distinction. I'm saying that Biden didn't do what was necessary.
Yeah. So it's not. It's not
No,
the
it's the donors.
That
it's the donors.
It's the donors.
Yes, it's the donors, but it's also neoliberalism.
Yes.
It's also the ideology that permeates the donor classes and the people from the parties. And that particular ideology is all about profits over people.
Exactly.
And markets over people. That's what we're looking at here. So the point is, can these people give up their ideology and understand that in the middle of the climate crisis, it must be people first, because if it's not people first, society is going to break down, and that's going to be terrible for them as well as for everybody else.
I think they're
able to protect themselves.
That's why I run as a green, despite being attacked from the left and the right, because people will say, oh, well, if you get out of the race because you're going to take votes away from such and so. And I say, no, I will not get out of the race, because we're the only people who are talking about these things that are necessary to do. And if we're not talking about it, then we don't have a movement. Somebody needs to talk about it in order to give energy and strength to the movement. And we need to work together, grassroots organizing and political campaigning, to make that groundswell happen, because that's the only way it's going to change, in my opinion.
Yes, you're absolutely right about that. Not only are you right about that, damn it, it's their job to earn the votes of people. If the people want to vote for you, because you have a better message and you're expressing policies that are good for them, you're not committing some crime, by doing that.
No.
It's the Republicans and Democrats who are committing some crime by not doing that.
You got that right.
Marilyn, Madeline, I'm so sorry.
That's all right.
I really think that, let's just get back to brass tacks here. I want to leave
brass tacks.
I want to leave the current politics as it has run in the last 4 or 5 years. I just want to leave it aside for a second.
Okay.
Let's just talk New Jersey for a minute.
Okay.
Even though you've got that pharmaceutical monster sitting in there, right? And we already know that we've got the senators, and we know how all that junk works, right? Let's just think about the idea. You said that there are several organizations that had been talking about a state single payer, right?
And organizing around it too.
Yes. Right. So let's talk about the idea of, on the ground, getting together with those organizations, getting the word out, getting into their email lists, disseminating that this is the ideas, maybe put together a summit where you get those organizations to come on the Zoom
Folks,
call and talk about it.
hang on for a second. I have someone at the door.
Oh, okay.
There might be some kind of emergency around here because it's
Oh,
kind
sorry.
of late. Okay, but go on talking,
All right.
and I'll see what's
Oh, I
going on.
hope they're all right.
I hope everything is fine. Yeah,
Yeah.
that doesn't look good. Doesn't sound good. I mean, I do think, Lisa, that
How you doing, sir? Just a quick question. Your neighbor Edie, have you guys heard her TV on like all day or anything like that?
She has always been loud,
Okay.
always. She's a very sweet person.
Is she
I think
hard of hearing?
She may be.
Definitely, I would think
We're
so.
not sure. But she
Okay. Okay.
When's the last time you
Ignore
ever
it.
seen her?
Yeah. Okay.
You can only hear it
I
in the
remember
hallway.
seeing her about 3 or 4 days ago.
Okay.
When's the last time you remember seeing her now?
Oh boy.
It was a few days ago,
A few days. Okay.
Okay.
And you've heard the TV up loud like this?
always,
Oh, yeah.
Always?
always,
Okay.
day and night.
Have you seen her get any visitors recently?
Go ahead, John.
No, we haven't seen
Okay.
her.
You want me to see it on
Oh, we were not.
Are you good? Um,
Okay, that was the sheriff's department coming to the door because one of our neighbors across the hall is playing, her TV very loudly. But
We'll see.
this is a common occurrence with her. She could have, been playing it very loudly and fallen asleep. She's 89 years old. So it's, that kind of situation. So someone must have called the sheriff's department to come in and check on it.
Mm.
And that's what it was. I'm not, I guess they were trying, to determine if there was anything wrong, but she's been playing that television quite loudly, for a very long time. It doesn't really bother us. It doesn't get into our apartment at all. We're much more concerned about there being something wrong in her case, but then occasionally we see her and she's going shopping or something like that. So I doubt that there's really anything wrong. But
Well, that's good. I'm glad that we'll
it is
find
something,
out.
So I just want because we were starting to talk about having a summit in New Jersey and bringing together the groups who have been fighting for single payer and then improved and expanded Medicare for all. And I would just have to say this, that we would need to, there's a split in New Jersey, just as there is nationally, between those who don't think it does us any good to work for a program at a state level, that we need to wait for the federal government to do its thing. And I don't agree with that. I think we've seen
But they're organizations, right, Madeline?
yeah,
They're not your communities.
this is true.
I mean, you still got it. You've got to talk to them, but then you've got to get real. Can you guys do ballot initiatives there or no?
Through the legislature, it's a little different.
Okay.
turn it down.
And-
So
can I turn this down?
okay, so I have the same issues that you're discussing. There are people that are just, they don't even want to talk about potentially helping out the southern states just to expand Medicaid. Well, real humanitarian mission on that one. I'm not buying that. I think that there are forces that, make darn sure division is a ruling tactic. Okay, we've got this house over here that kind of has this brilliant idea. Okay, really. And we've got an environment where we have people striking and they know that their life is the way that it is. Vast majority of the situation is we can't even get a raise because, your benefits, right? And that was good for even industry for a long time that wasn't healthcare because it kept wages down until their administrative costs ballooned from the standpoint of how much they had to pay for healthcare as an organization, dealing with trying to get people to work. Now, it benefited business for a little bit, but now it's not anymore. Okay, that's really what's going on. People had to go to work because they needed their health insurance until enough people started losing their homes when they realized that this health insurance is shit anyway. It's not good, right?
Right.
That's why people are striking. I mean, you can get down into the people now, and you don't have to talk Democrat or Republican. You just talk about crappy wages, crappy work conditions. I'm sick and tired of my health care being tied up with this employer who's treating me like garbage. Time's now. I don't care about any organization that got money and has this wonderful speaker and puts me on a Zoom call every Sunday night at 8 o'clock. I'm like, good, you do that. I'm going to go over here and talk to my grassroots community organizations, right? I mean, ground game, seriously. And I just really think that with a couple of years, you could get the people behind you, and you wouldn't even have to worry about who's coming along and yelling at you because you're running, because you're already going to have the people behind you.
Yeah, I mean, I've sort of tuned that out over time, primarily because we have a very large amount of young people working on this campaign, high school students and college students who are already disillusioned with the pace of change, already disillusioned with what the Democrats and Republicans are not doing, and
Well,
so
yeah, they should be disillusioned with that.
yes.
Because it's they who are going to have to cope with it.
Yeah, they know that, their future doesn't look the way they want it to look. And when last year, especially with the people trying to get Trump out, there was some pressure for me to drop out. And I said, I'm not going to do that. I will not do that, because the young folks who are coming up who've never voted, or who last year voted for the first time, if the one vehicle that's out there right now for them to actually express the sense of urgency and disillusionment and the need for change, if that person drops out of the race, there's going to be a whole generation of people who are going to wonder about what's coming up next. So I don't know. I mean, I do believe that most of this is done from the grassroots up. In my running and my bringing up these issues, I've heard people say, even if it's a national, in their minds, it's a national issue, they say, but as I'm really happy that there's a candidate for governor who would be bold enough to say these things. And so it's I don't know if you're contemplating a Pennsylvania New Jersey summit, or if it
I'll
would.
do whatever works for whoever wants to do it.
Yeah.
Like I worked in healthcare in the state of Pennsylvania. I was not allowed, I had a fiduciary responsibility, and we were trying to keep a private provider alive, right? Ultimately it failed, but that doesn't matter. So I've got UPMC here, and I've got Highmark here. They're headquartered here. Okay. And I've got big tech here, and Pennsylvania's got its energy here. Right. So I've got like the big five here, that would be absolutely against, any type of a single payer type of thing, right? Or Medicare for all, for that matter. And so I tend to like to reach outside of my backyard. And there's a lot more to that, but there are reasons why I go someplace else. If I had anybody in Pennsylvania who wanted to work on this, that was serious about it, sure, I'd help them. But Joe had you on, and I'm just like, oh man, she's great. Like, she's great, right? And I don't really get all that excited about candidates that often, maybe it's because I don't get to meet them up close and personal, but you just seem like you've got it together, and you've been doing it for a long time. Like, this is not a new show you just took on the road, right?
No, I've been an
Right.
activist all of my adult life, which is now approaching 45 years.
Right, exactly, right? So, I'd rather just help people like you who've been in public office, who've run for public office, who've been activists, and thought that a state single payer plan was a good idea. I love that idea. So
I appreciate your comments, and I don't like being called a politician, because I'm really not. I'm an activist. I don't like it when people think I'm doing this to promote myself or my own career, because I'm not. I'm doing it to build a movement. I'm doing it to build an alternative to what we've got out there, and there is a lot of energy out there. That's for sure, and that's because things have just sort of fallen apart for the last. First, before the pandemic, they were falling apart, and then during the pandemic, the economic system has shown all of its ugly side. Um, and whenever people would say, "Let's go back to normal," I said, "No, I know normal wasn't so good. We need something totally different." And I'm not shy about saying what those things are. I'm not shy, but I do better, and I know that it's more effective if it's not just me using the platform, but it's bringing people together to push for it. And yeah, we'll see. I know. I think when this Washington plan is good. The whole Washington plan is good because it puts specifics together and looks at the economics and how you would raise the money for this. I mean, it's not just somebody saying, "Oh, we can do this." It's somebody proving that it can be done or showing how it can be done. And I think that's we don't always get that. We don't always have that concrete example.
yeah, and
No,
just to
it
piggyback,
is rare to have that. Okay, and it's rare for Jerry Friedman to have done an economic analysis for a state. That was an important thing that whole Washington did, just to get that done.
yeah, and just real quick, I wanted to build on what Marilyn was saying. It wasn't good before the pandemic. I think where we've gotten to, just in my observation, I was that first generation that really couldn't live in the hometown that I came from because there just weren't any jobs.
Mm.
Okay. And I watched all of my friends leave, right? Everybody went to college and didn't come home.
Mm.
So we got separated from our generational family. I mean, literally, right? You go home on holidays and whatnot.
Mhm.
Economically, I think what has happened is not only is it the younger generations that can't make it, but now you've got my generation that have millennials as kids, right?
Mm.
And we're slipping.
Mm.
And now even my parents, the boomers, are starting to see that they're screwed too. I mean, everybody now is starting to feel it. So I think that politically,
Mm.
there is a vacuum. Everybody sees it now.
Yes. Yes.
Right? And it wasn't like this 3 years ago, but it's like it now. It's here now. That's what I see. That's why I'm so excited about it.
But it's also true that the person who's trying to move into the vacuum, is Trump.
Mm.
Yeah, sure.
Okay, and the Democrats seem intent on trying to maintain the vacuum that gives Trump his power. And that's the real danger, okay, in this particular situation. People just can't seem to get it through their heads that they have to turn to new alternatives, and they have to turn all at once. They have to determine that even in the context of a single election,
Mm-hmm.
that they just have to move en masse to an entirely new alternative not associated with either of the major parties. They have to recognize that Trump is not a part of the vacuum who's rising up to serve the vacuum, that Trump is one of the major parties. He has taken over one of the major parties. He is not something new. He is simply neoliberalism on steroids,
Mm-hmm.
turning into completely transparent crony capitalism, even mafia capitalism. That's what he represents.
Well, and
If people could come to understand this, then maybe they could realize that there is no alternative but to embrace one of the third parties that is offering something new. But to me, the best of the third parties in this respect that exist at this point, okay, is the Green Party. The reason why I think, okay, the Green Party, okay, is the best is because the Green Party is full of dedicated people who have tried to serve the Green Party for many, many, many years and have tried to do what they think is right for all those years. Now, I know people from the mainstream and from the major parties talk about, the lack of success, okay, of the Green Party, and they blame that, okay, on the Green Party, that they're, politically ineffective. But it wasn't a case of, being politically ineffective. It was a case of being shut out
yes,
by the mainstream media that are totally without any ethics and are totally without any motive except to serve their owners. I mean, that's what it's been about. If you can't get through the mainstream media and they're dominating the situation, how can you be effective? You can't even communicate with people.
Get a fire stick. That's what I did.
what do you
I
mean?
don't watch mainstream media. I mean, I know that this is hard, but
Oh,
it's a generational divide, I think.
well, but it isn't only, because here's a very current example. Okay, we just had gubernatorial debates in New Jersey. We had two. They were mandated by state law, but state law also mandated that you could only participate in the debate if you raised $490,000, just shy of $500,000. Now, I went to the second one of those debates last week, Tuesday, or earlier this week, dressed up as a $490 million bill to try to make the point, okay, that this is just, it's ludicrous,
Ridiculous.
it's outrageous, and all of that. I just listened, and I it gave me a little more fire, as if I needed more. Gave me more fire to write this press release that's going to go out first thing Monday morning. I listened to New Jersey's cable TV station, News 12 New Jersey, talk about the debate as if there weren't any other candidates out there besides Chitterelli and Murphy.
There
Not
weren't
even,
any parties.
what's that?
I say there were no other parties out
No
there
other parties.
except for
They,
the Democrats and the Republicans.
they did not mention the $490,000 threshold to qualify. So they tell people like less than half of the true story. And yet, on Facebook pages where we've been putting forward some of our ideas in the form of ads, that we boost. We're getting torn apart by people who have that propaganda stuck in their heads. They just have that propaganda stuck in their heads. And so, I mean, it's, yeah, we can turn it off ourselves. We can try to counter the propaganda. Um, we need to keep doing it, and we need to try, just keep trying to break through the stranglehold that the two parties have with, as Joe is mentioning, the media sort of carrying the water step by step, with those two parties. Um, yeah, I don't
I
know.
think they're not simply carrying the water, they're drowning out the
That's true.
alternative messaging.
Yeah, they're using the water to drown everyone else. No, you're right. You're absolutely right.
Yeah. Yeah, they are.
Okay, so to really do something like this, okay, in New Jersey, okay, and get it passed um, in any state,
Hmm.
there's going to have to be a ground game. People are going to have to go from door to door
Hmm.
and get those signatures in support, okay, of bills. There's going to have to be telephone campaigning. There's going to have to be hundreds and thousands of people involved in this. People that make enough noise to drown out the mainstream media. Uh, how can we get those people? How can we get such a ground campaign? Well, we had that kind of ground campaign in the Bernie Sanders campaign in many states. He was able to organize that, okay, and get that going, or people who worked for him were able to organize that, okay, and get that going. Where do the Red Berets come from? They come from that Bernie Sanders campaign. True, Lisa? They were,
Yeah, I mean, they were Bernie supporters, yes,
they
and I
were
think a
Bernie
lot of them
supporters,
volunteered. Yep.
and they were brought to activism,
Hmm.
but through what Bernie Sanders did. And Bernie has now let everybody down. And in letting everybody down, he's also freed everybody up. And they're now looking for other things to be active about. And the Red Berets' choice was to devote themselves to Medicare for all. And the Red Berets have been developing a ground game. The Red Berets in whole Washington have been developing a ground game, which is beginning to go national now. They're going to try to spread the methods, the energy, the techniques into other states. And that has the potential to change our politics. When Bernie
So,
said, but not me, us,
right.
he didn't mean it. He showed us that.
Well,
But that,
I'm gonna go a little bit on the defense here for him because, and I know I'm probably gonna take a lot of heat for this, but Senator Sanders used to be the Democratic outreach guy while they were the minority. Okay. Now they're the majority. Joe is in the White House. I followed Joe for 40 years as a public figure. I know exactly what Joe is. I know where he comes from. I know how he does things, right? I know his policies. I know a lot. Bernie went from being the Democratic outreach chair to running his second campaign. COVID hits. We all know what happened. I don't need to rehash it. But he's chair of the Senate Budget Committee. He's not the Democratic outreach chair, right? And I don't think that most of the people understand that. Everybody's like, well, where's Bernie? Well, he's chair of the Senate Budget Committee. He doesn't have the same job for the DNC anymore. He's got a big job now, And he's working on this reconciliation bill as well, which, by the way, they're saying could drag out for, Joe said, even if it takes 6 months, right? He doesn't have the same capacity anymore. Neither does Warren Gunnels anymore. I mean, that whole dynamic has changed. I understand that people feel let down. I feel let down by what happened with all of the people that I dedicated a lot of time to get them elected, donated money to, and then they got up on the Hill and they shut up. Pramila Jayapal introduced her legislation, and then what happened?
She shut up.
They all shut up, right? So they have all let us down. Okay,
Right.
all of them.
That's not
And
my
the only
point
one that
so
I
much.
see still fighting is Bernie. Quite honestly.
Right. Okay. But
Still
that's not
putting those bills
really my
together.
point. Okay. I think you're missing the point here, Lisa. What Bernie became was the leader of a movement that was a bottom-up movement in the campaign. Now, he had never been that leader actually earlier in his career. I'm not talking about his policy stances and whether he's still for Medicare for all, okay, or really and truly, okay, in back of green measures. I'm sure that he is in what he himself thinks that he is fighting for. What I'm saying is, for a brief moment, was the leader of a bottom-up movement. And in making the decisions he did, he abandoned his position as the leader of the bottom-up movement. And in that context, he freed up the people in the bottom-up movement to generate new leadership from that movement. And what I'm saying is that movement is doing so in various states, in various ways, with various leaders. Okay. I think Laura Fielding is one of those leaders. Yeah, she's a mini leader compared to Bernie Sanders, but she's pulled together, a group of people, and she's pressuring for Medicare for all, as we all are, and joining with her. It's not a formal organization. It's not an old style pressure group. It's kind of a network, okay, across the internet. And it's got a lot of threads connecting the people into various movements and into various places, various states, various communities around the country. And the movement is growing and getting deeper, and it's gaining more power. And it's a new thing because it's a bottom-up movement. It's really democratic, small d, in that sense.
Yeah.
Okay, Bernie facilitated that. He birthed that in a certain way. But it's no longer his movement.
It's true. And we can do ground game. The movement cut its teeth on Bernie Sanders' 2 presidential campaigns. Let's just be honest, right? Presidential campaign is you've got the good guys and the bad guys when you come right down to it, right? You've got this camp or that camp. And that's how people were thinking. And you have a heck of a lot of money to go and knock on doors. But when you want to do a ground game for an issue so important as healthcare, you can do it without having to canvass knocking on doors. You can do a ground game county by county. You can do it the same way that we did it in the census, where you reach out to the community organizations that are serving the very people that, healthcare is so important to. People that are in the food lines, the people that are using your community outreach organizations, utilizing them to, get their services, stay fed, stay clothed, whatever it is, right? You can reach a lot of people going through those kinds of organizations, going through your faith-based organizations, going through your social services orgs, like I said, food banks. We hit up schools because when COVID was going on, parents had to drop their kids off and pick them up. So there were lines around the block. And we had signs and tables when we were trying to get people to sign the census. You can get into those organizations and let them know what you're doing. Those organizations, those very organizations, are the ones that are going to be like, oh, wow, that sounds like a great idea.
But I have a word of caution for all that because I've seen it happening in New Jersey. It dies if it gets swallowed by the Democratic Party, or if it targets Democrats to say, let's go after this Democrat, that Democrat, because as soon as we start down that road, there might be a few outspoken Democrats, but they, as you've said earlier, they go quiet or they're outnumbered by the neoliberal, neoconservative Democrats. And so everything just shuts down. We've seen it far too often. So it may have started with Bernie and is now coming from the ground up again. Let's not have it get swallowed up by the Democratic Party. Let's keep it independent and put pressure on both Democrats and Republicans.
Yes.
Because yeah, I mean, I'm not naive to know, not naive to think, so naive that I would think we can't do anything. We can do this without people's support in the Congress, but we can't adjust our message or adjust the way we're going to do things based on what we think they will allow. We have to just have to keep it going.
Right. Right.
You know,
That's the power of going
Mhm.
on the, hitting the ground and avoiding the top down,
Mhm.
what everybody calls ground organizations. I mean, anything that's top down, things go there to get watered down or die. That's how that all works, right?
Yeah.
If you go straight into the people, into your communities, and you work those communities that, you start with the ones that are going to need it the most,
Okay.
and you talk at it that way, there's you're killing a million birds with one stone. You're talking
Don't talk killing birds.
What'd you say?
Don't talk about killing
Don't talk
birds.
about killing birds.
Oh, it's an old
Sorry.
saying. Okay. Let's see. What are you doing? I mean, you
I know exactly what you mean.
You know what I'm saying? Like,
yes, you do.
you can't. When I think about doing this kind of stuff, I always get somehow surprised when some organization wants me to come join their meeting, and I'm like, oh, okay, I'll come join the meeting. And then I usually join one or two meetings, and it's like, yeah, that's a big damn waste of time. Why do I keep getting pulled into those things? Because it keeps me from doing what we're doing right now. I really believe that.
Yeah, and I think we've all been conditioned to think about, I shouldn't say all, well, because maybe I was, but since, say, around 1980, I've been politically independent. I did, full disclosure, I did vote for Bill Clinton. And then, all hopes about a national health insurance program were dashed within a month.
Oh, yes.
And then when Obama started talking about health insurance, I knew that not to get suckered into that. I voted for him the first time for other reasons, but could never vote for him the second time. The rhetoric that Obama used on healthcare was even weaker than the rhetoric was far weaker than the rhetoric that Clinton used. And I said, if Clinton used that rhetoric and gave it up in a month, this isn't going to go anywhere. Or if it's going to go somewhere like it did, it went into the Affordable Care Act.
Yeah, where it went was into Max Baucus's hands and Liz Fowler's hands.
Yes.
God.
So we can't, I mean, we've sort of been conditioned. I understand, Lisa, that somebody, a nonprofit organization or somebody says, come in and talk to us. I do that. I do it. Usually if somebody says do that, I will, because you always hope that that somebody will be in there who's going to say you're right and let's push this. But more often than not, we're disappointed by um, just how easy it is for those groups to just give in to what they see as political reality. Political realities, pragmatic politics, all of those words. I'm like, no, don't say those words again. Please don't. Because it means letting the elected officials dictate the agenda. And we know where that gets us.
Yeah, they dictate the agenda. They dictate the candidates as well. Uh, it's no democracy. We have to get rid of it.
Yeah, we have
Without
to.
going to the fascists, we have to get rid of it. That's the difficult part of it because everybody sees, at least so many people here in America, see the fascists as the alternative.
Oh, and I think it serves. I think that serves the Democratic Party's purposes. As
Yeah, it
long as
does.
they can say it's Trump, it's Trump, it's Trump, it was Trump, it was Trump. Oh, at least he's not Trump. Oh, do you want Trump again? As long as they can do that, they don't have to come up with real policy alternatives.
Yes, but it's a less powerful appeal now because Biden has been so
Mm,
disappointing.
mm,
We expected him to be somewhat disappointing, and maybe I expected him to be as disappointing as he is. But
Yeah.
I'm not sure all the people who voted for him expected him to be as disappointing as he is.
I agree.
So they must be getting pretty PO'd by now.
What do you think in Pennsylvania there, Lisa? What do you think?
Well, I have to tell you that where I live, it is pretty heavily Republican. So, let me tell you in all honesty that they're not yelling and screaming, and it's not the first thing on people's lips anymore. My neighbors, we're talking to one another again. We go out and we walk our dogs together again, and people smile, and it's not this. Everybody's not like in their little camp anymore. I think that since the pandemic, uh, with Trump out of office and that horrible division. But my friends that are very conservative will tell me that like Biden's a joke. I mean, but it's not this knockdown, drag out anymore. But nobody likes any of it. Nobody's better off. I mean, unless even, I mean, I don't know. I don't even know if it feels like everybody is, once they got rid of the swirl of crazy from the election cycle, took an exhale, started to look around, and now people are going, this is still a mess. It's not getting any better.
Yeah.
Feels like it's getting worse.
I hope I would think that would be true, and especially when we see all the workers going on strike and all the places who are trying to hire, who say they're hiring and can't get workers to come in and to take the jobs because people realize it's not anything close to a living wage. So this is yeah, I guess what is that expression? Don't mourn, organize. I guess this is really a time when that applies, right?
I think it's
Yes.
it's heartening to see everybody going on strike.
Oh yeah.
It's heartening. It really is.
It certainly is. Yes, it certainly is heartening. It's a wonderful thing. Oh, also, by the way, that October 30th event in San Francisco, the Day of the Dead.
Yeah.
I think that's going to be quite an event.
Did you hear about that, Madelyn?
No.
The day of March for Medicare for All activists, along with Red Berets and some folks from New York, 2 activists in San Francisco. They're doing a Day of the Dead, which is a protest or a demonstration where they're going to dress in funeral attire, and they're going to be carrying a coffin, and it is to bring attention to everyone that, where they're demanding Medicare for all, and they're also at the same time going to honor the dead from the pandemic and all of those that are dying because they don't have health care. So
That's right. And they're going to march also to Nancy Pelosi's house, and they're going to hold a vigil there in front of her house, as well as part of the ceremonies. Okay, the Day of the Dead. So I think that's a very interesting thing. I'm, interested to see how it's going to develop, and whether I'm not sure she's going to be there for it, since she knows they're going to be there. But I'm sure there'll be some press coverage for that. That won't be buried.
Is this only going to be taking place in California?
It's only going to be taking place in San Francisco. Yes.
Yeah. So, but maybe some people can
do an offshoot of it, I'm sure. I mean,
express support for it or something like that.
Yeah, I did hear that somebody was going to do that. There was an activist who said they wanted to mirror it in another location.
Wow.
That was about a week ago. So, but yes, yeah, I wouldn't see any reason why you couldn't do that. People wanted to.
Mm-hmm. Well, I'd even just use it as a time to issue a statement about the need for this. And anyway, this is the time when my brain starts to shut down.
Me too. I think the demand.
Did you have any other questions to ask about the whole Washington situation? Has anything else occurred to you while we've been just conversing generally?
No, I mean, I think I was thinking before about pre-existing conditions and certain kinds of treatment. Would those all be covered? And it seems to me that from what you've been saying, that yes, they would be. There's no such thing as a pre-existing condition. There's no such thing as, hey, we're not going to cover this kind of treatment because it's experimental. There's not that kind of chasing after an insurance company to give you money for something. The only, there's a situation with someone I know whose insurance only covers her when she's in New Jersey. When she was in Delaware for vacation, it didn't cover her. I mean, there's so many ways in which the system fails people, that it seems like this would not, but it might need, if you live in one state that has it and you go into a neighboring state, you might have to have some specific thing, that might need to be applied so that it could cover you in the different state.
I do remember Georgia talking about this maybe months ago. So there is, if you go to the wholewashington.org website, there's more information there, and I think
there's plenty more information there. Very extensive information.
Georgia did talk about this. I'm not exactly sure, Marilyn, but they did talk about it. Like, I don't have the right answer because I don't remember what it was, but they did address it.
Yeah, I'll go check, and I really appreciate having been invited to join you today, both of you tonight.
Well, we really appreciate your coming. We very much enjoyed the conversation. Okay, and we hope that you will take a look at what the plan has to offer, and if you think it's a good plan, perhaps include it in your state budget.
Yeah, and I did actually try to look. I did look at it this afternoon, before the program, but there was too much to look at. Now that I have a grounding in it, it will be a whole lot easier to take another look and see
Good.
how things apply. And yeah, so thanks a lot. Thanks a lot.
Oh, it was such a pleasure to see you again. And Marilyn, I'm going to need an address so that I can. I got to tell Laura that you want a beret, and then we'll get it off.
All right. I can give you the campaign's address if you want it.
That would be great. You could just type it in the chat.
All right, let me do that now. And yeah, I mean, I saw a Twitter post with somebody. I still haven't found it. I was looking for it the other night. I couldn't find it again, with somebody who was in the process of making a beret.
Oh yeah. Well, I found your Twitter handle, so we can start including you on some of the Red Beret tweets.
Oh, that would be great, and I'll go and I'll make sure we're following you.
Yeah, I'll tweet at you, and we'll figure all that out. Because I did make some posts about you. I think I've done like maybe 4 or 5 where I've tagged your account.
Okay. I
Madelyn.
thank you for everything like that. Yeah, because I was doing activism before campaigning, and I'll be doing activism after. That's for sure.
Cool.
There you go. There it is.
What part of Jersey are you in?
I live in Morris County,
Okay.
northwest portion, but I spend a lot of time crisscrossing the state. So
Oh, I bet.
yeah, I mean, there's so many. That's the only way to campaign, is to go to every corner and every county and talk to people, because every county has different issues. I should just say, people can check out my website too. It's Hoffman for Gov NJ, all lowercase, Hoffman for Gov NJ.com. And we are still looking, even for $5 donations, $10 donations, to help us distribute these ads. We're going to do one on Medicare for All. That's one of the ads in the pipeline, and so I need to take a look at what's been proposed so far and maybe add something in there about these the kind of whole Washington plan. So that's one of our issues. If people want to give us a little financial boost to get them out through Facebook and other means, that's HoffmanForGovNJ.com, all lowercase.
Okay, so on that note,
Mm-hmm.
I think it's time to say goodnight.
You going to read any comments tonight, Joe, or no?
Were there
Well,
any?
it's already 11:25. I can quickly scan the comments.
There's a ton. I just was wondering if maybe Marilyn got any question. Madelyn. Maybe Madelyn got some questions. I was just hoping.
Yeah, you'll get out of this. I'm sure very quickly, Lisa, you'll change the meme inside your head and get that Madelyn straight.
Do you know, I have a niece named Madelyn, so it's really because my husband's father just got married. I know that's why I keep saying Marilyn, and I'm so sorry.
No need to apologize.
I call you Maddie like I call my niece.
As long as you don't call me Mad. If you call me Maddie, you can do that. Not Mad, please. I have bad experiences from junior high with people calling me Mad. You can
I interviewed somebody a few years ago who was running for Congress in New Mexico, and she liked to be called Mad. That was her nickname, and she liked it. Okay, and she lived it. But she was a rancher, in New Mexico. I forget if it was rancher, or a farmer, in New Mexico.
It was used to tease me
Good
on
candidate.
birthday when I was in junior high.
I'm sure.
It just I can't. I mean, I can hear it and I'll respond to it, but I'd prefer not. But Maddie's okay. if that
I
helps.
just need to trick my brain. That's all.
Yeah.
I am so sorry.
No, like I said, no apologies necessary. But I'm ready to call it a night unless there's something that you want me to hear or respond to.
Okay, I'm going to quickly scroll through that. But Amberly Grigo suggests, what is the disconnection between the acceptance of the single payer system for the military and a similar system for the rest of us? Why are people so ready to accept a
Mm,
single payer system for the military?
mm,
I actually think that's an easy one to answer, because once you get into the military and they tell you what their coverage plan is,
mm,
you have no alternative but to accept it. That's the
mm.
plan that the military, is giving you. And then afterwards, when the military people and their families find that it's really a very good plan, even though it is a single payer plan, uh, I think most of them are very happy with that plan.
Well, and it's like the members of Congress, right? They all have some kind of plan like that too. And there was a move for a while to say, if they can have it, so can we, and to shame them into thinking that uh, they have something that the people they represent don't. But I'm not sure where that stands right now.
Does Day ask a question? Why would Veterans Administration health become not available? But nobody's saying that it would not become
Nobody's saying.
available. It's just that its funds would not be turned over to the states. It's just something the VA is always excluded from these plans. In fact, they're even excluded from HR 1976. It's just understood the VA is going to have a separate program, which is, by the way, it's not just a single payer program, but it's akin to a national health service,
Yeah,
but
it's
it's
run by
only
the
for
government.
military people. It's had its own hospitals, its own doctors, basically, its own everything, its own freedom to bargain with the pharmaceutical companies, which it uses to very good effect. No other part of the government has that ability to bargain with the pharmaceutical companies that the VA has. Okay, a lot of the comments we got here today were from spammers, probably the same person, with different identities, essentially
You're doing something right, Joe, if we get trolls.
obscenities.
Right.
Well, I think these trolls are coming in part from the KRTD media end.
Really?
Yeah, because Shane had always gotten these particular trolls on his his channel. So now that we are also streaming to KRTD media, we occasionally get the invasion of the trolls. So this is the worst invasion I've seen so far of the trolls.
Well, it could also be the people who have been following me on my pages, though I don't think I publicized this on my page. But the level of trolling is just out of control right now on my page.
Yeah, the level of sheer vitriol.
Yeah, exactly. So they might have been following me because of the race, and like I said, I've just whoa. I mean, some of the things that people say, you just have to tune that out.
So Carmen asks a serious question. Will the whole U.S. want to move to Washington State? Will the influx be sustainable for the state-based system, of Medicare for all? Well, there are restrictions on that. In other words, people will have to live in Washington for at least 6 months, until they're residents, of Washington. Until that time, they won't be serviced by the system. And but second of all, they probably aren't going to move to Washington unless they can find a job in Washington. And if they can find a job in Washington, then it's fine if they're part of the system. There's no problem. So I don't see that much, okay, of in terms of people, actually moving into the system. But if people want to move to Washington State, and the economy, okay, is awakened in part by the single payer program, then really in the long run, I think that people are assets for states and losses for the states who lose them. So that is, not all a negative if good people move to Washington.
Or if it becomes clear that it's a very popular kind of program, it could provide some impetus for other states to do the same thing.
That's what
Yes,
we think, Madelyn.
What's that?
That's what the Red Berets and whole Washington. That's what we think.
yes, that's what we think.
We really think that it's not going to take that many states to do it, to prove that you got to do this nationally because it works. It saves money. Everybody's covered, right? And I'll say one more thing in the weeds, but I would think if you put plans together like the whole Washington plan, if you got to a point where they wanted to do it from a national down, the money's in a trust. You've already got the beneficiaries taken care of. You don't have to go find them. You've already worked on the infrastructure. Flipping that switch, you've already got your templates for implementation. It just seems like it would make so much sense.
We really also suspect that once Washington gets this, that Oregon and California are not going to be far behind.
That's a good point, too.
And those states, those 3 states, I guess, are altogether about 54 million people, or something like that. And then in states that are close by and that are blue states or close to blue states, purple states, Arizona, Nevada, Colorado, also New Mexico, we think they won't be far behind either.
I'd love to see a Republican state do it too. I really would.
And as you said before, Lisa, it's not about partisanship anymore. It shouldn't be about partisanship. It should be about policy, and it should be about the person and the people and the states who are and the organizations who are promoting these policies. This is where we have to get there as a country. We have to be focused on policy, not Trump. Not Trump. No, policies, folks.
Policies
and action,
Yes,
right?
yes.
That's going to help not only the people, the economy, the small businesses, the employers.
Yes.
We're not just talking about a segment of people that everybody can't relate to. We're talking about everybody.
That's right.
Everybody, right?
Right. And that's right.
Healthcare is it.
It's the big issue of the day in part because of the pandemic and everything, all the issues that have been raised by that.
Yes.
Did you hear that John Deere is going to take the strikers' health insurance away on the 27th to try and force them back into the plants?
No, I did not hear.
Yep.
Mm.
Yeah, that's exactly what General Motors did, of course, very recently.
So all the more reason, like we've been tweeting the heck out of all of that information, trying to get that information out far and wide so that people are following those strikes.
Please tag me in those, and I'll.
Sure. Would you want, Madelyn? I don't know how you feel about this, Madelyn, but I've got a room of about 10 people that someone else put together, but we're all very trusted individuals, and I can put you in the DM room. You don't have to talk to anybody. You'll just be able to see what we're doing.
Sure.
And I can tag you in those tweets too. It's just that I can't promise that I'm doing a lot of retweeting, not too much tweeting myself is what I'm trying to get at.
I completely understand. So yes, putting me in that room and
Okay.
I'll get to see things and retweet them myself. But I think it's time for me
Bedtime.
to say goodnight.
Yeah, me too. I'm getting tired.
And I don't trust what I'm saying anymore.
Okay, Madeline. So I'm going to let you go.
Thank you.
Good night and sleep well.
Same
Talk
to
to you
you guys.
soon, Madeline.
Yeah,
Thank you for
definitely.
coming.
And thank you,
Okay.
Joe.
And I think we're going to see you tomorrow in an entirely different venue, but we shall see.
Oh, yes. Okay.
Okay.
Okay. Good night.
Okay. Good night.
I love her.
Yeah, me too. So, have you anything else that you would like to say, Lisa? Would you like to cover some of these questions that we've gotten?
Sure, you could. Yeah, I'll stick with you.
Okay, we have one from Carmen. I've skipped all of the obscenities that have come our way tonight. Carmen says, Washington State is close to Canada. Could that state form low-cost pharmaceutical alliances with Canada? Perhaps even medical supplies and HCPs. Okay, my own opinion is I don't see any constraints in the whole Washington plan that would stop them from forming alliances with Canada. Now, the population of Canada is not really that high. I think it's like 38 million people. I try to keep these figures in my head. I think it's something like 38 million people. So Washington would add, okay, another 8 million people to that as a pool. So maybe that would be a valuable addition to Canada to get even lower costs in these areas than they're getting now, since it's another 8 million people. But I don't, really know about this, whether that's a possibility. But I don't see anything in the initiative that would stop them from doing that, from forming a low-cost alliance, Carmen. Have you seen anything in the initiative, Lisa, that would stop them from doing that?
The only thing that is going through my head would be, would it be legal for them to do something like that? I mean, I just feel like there's probably something in the mix that would preclude it.
There might be something in the mix in the sense that the Medicare program is prohibited from bargaining with the insurance companies. But I think
we're talking about getting drugs from another country, right?
Yeah, we're talking about, well, no, not necessarily importing them from another country, because what Carmen is suggesting is joining a bargaining unit with Canada,
right,
to get drugs from the pharmaceutical companies. No, just joining with Canada to get a common price, not necessarily getting drugs imported from Canada, but getting the same drug companies to sell the drugs to Washington State. Those drug companies might well be based here.
Yeah, I mean, hey, if you could do it, great. I just have a funny feeling that
there may be something in the mix prohibiting that.
I don't know, but yeah, that would be great. If you could do it.
But one of the appeals of the Washington State program is that they are going to negotiate with the pharmaceutical companies for lower prices.
Mm-hmm.
So if they're going to do that anyway, why would it be prohibited for them to do that in combination with the Canadians?
Well, I don't know, but now you're going to make me dig, because there's just some sticky wicket, and I can't put my finger on it, that I think would preclude us from doing it. However,
it's a very interesting question, Carmen. Thank you for bringing it up.
Yeah, but I want to touch base on that again, because you do know that all the pharmaceuticals, most of them are being being made from, they're coming from the same places, right? The same corporations are made, they have the patents on the drugs, they have the distribution, they're coming, blah, blah, blah. Supply chains, they come through the supply chains the same way. Canada's the one that has let's just be honest, the permission from the drug companies to negotiate with them. Okay. We don't. So I'm just trying to, I want to find that answer. I want to find out that answer.
Yeah, it's a very interesting question. In fact, it's an interesting question that puts a state single payer in an interesting position.
Doesn't it?
Yes, but I think if HR 1976 was passed nationally, it is in that bill that we would be able to negotiate prices with the pharmaceutical companies. And Carmen says, I prefer LPNs over doctors anyway, any day. I'm not sure, okay, what LPNs are.
Does she mean ARNPs, like nurse practitioners?
She may.
Yeah.
Insurance companies, insurances are paid by denial of access, but facilitators and stock buyback entities. Insurance companies, you mean? Yes, I certainly think that's true. And Carmen says landlords and private insurance companies and neo-feudalists.
Neo-feudalists. That's a good one. I'm writing that one down.
They're not the only neo-feudalists. I think the hedge funders are neo-feudalists also. Carmen Muniz says, try not to get sick. I make fenugreek tea for chronic appendicitis, flare-ups. I never go to doctors. Carmen says, by the way, Colgate has an antimicrobial mouthwash now called Swish. Good to have for obvious reasons. Carmen says, climate hell is here. We were 93 in Miami today, even for Florida. That is extreme for this time of years. Shake my damn head. And goes that says out Carmen Muniz. I swig mouthwash after all personal contact. He says, I also swab my nose with it, laugh out loud. I don't know about these healthcare. They're exchanging information on swabbing noses and sinuses because that's where COVID starts. Carmen says they're gerrymandering and rigging, sabotaging voting so that they can do whatever they want without actually needing our vote. So they can destroy democracy. Yeah, that's why they're doing it. Okay, let's see. Carmen says, Slick Willie gets to go to the hospital for an infection. We have to find black market antibiotics or alternative medicine. The oppressors get all the benefits. We get kicks. Yeah. Carmen asks about whether euthanasia is legal in Washington state.
Euthanasia?
Yes.
No, but you have a right to, I forget what they call it because I haven't been there for 8 years. An individual who has a terminal illness does have the right, medically assisted, no medical assistance, but to be prescribed medication as long as they take it themselves to end their life. That they are allowed to do, but not euthanasia, not where you put people down. It has to be they have to be able to do it themselves. Washington and Oregon has that.
Okay, so
Monica does.
what Madeline did was she left her address in the private chat.
Yeah, I got it. I wrote it down. That's her office box, her office address.
Right, her office box. I think I'm going to leave that in the public chat though, also, so everybody can see it in case they want to contact her. I think that could be helpful. There was an ad put in, well, an announcement by KRTD Media, Shane. Check, uh, check out Madeline on the KRTD Media Network. She does the news every second Friday of the month at 6 p.m. Check out her Columbia series every Sunday at 7 p.m. That's something, 15 episodes about her trip to Columbia, but just recently, with really real things going on, the real Columbia. She's introducing us to the real Columbia in this series, and you won't see any coverage, of Columbia like that anywhere else except at KRTD Media. That is a terrific thing that they're doing. Shane says if Democrats run Harris in 2024, Trump will be our president again. And no one is allowed to run against her because she was the VP. Carmen says, Shane, Democrats are dumber than a box of rocks. And Chase, as much as I hate the Democrats at this point, I'm not against there being a left opposition in the presidential primary. But there was no one who can fill those shoes left. Well, you could always back me, Shane. I'm only 82 years old. I think I'm a match for Joe Biden and for Kamala Harris put together. Shane says, ridiculous rules for these debates. Carmen says, Ms. Hoffman, are you allowed to use crowdfunding to raise debate money? Yeah, I think.
Yes, she is.
Yeah, certainly. And Carmen says, hi, Bonnie Boo. I see you're wearing that red beret. Smile. She was wearing the red beret. She was. She's taking it off now, I guess. Carmen says, not me, us was his bow out announcement. Yeah, I'm sure. Two of the top three investment firms that own MSNBC are the same two investment firms that own Fox and News Corp. So literally, Rachel Maddow and Tucker Carlson are owned by the same billionaires. And Steve Gonzo also says, same two companies also own Coke and Pepsi. Competition is an illusion. AT&T funds CNN, KNOAN.
Okay. Good night.
And I'm skipping through a bunch of things, and Bonnie is telling me good night here.
Oh, well, yeah. Good night,
So Jeff
Bonnie.
Denton says it's no democracy, but why do people keep whining about a vote but 10 months ago? Because maybe they want a democracy, Carmen says, can't even get pocket change around here. Stores are crying coin shortage. But propaganda again. I think there actually is a coin shortage. I think that the mint fell behind in actually producing coins because no one was expecting as quick a recovery as we got. And demand, is fairly heavy. But actually, Mike Norman gave a pretty good account of this on his show. He's been following these trends very closely. I'm skipping over looking for things that are. Carmen says, I couldn't find any strike coverage yesterday. Did you guys?
There is a great report. Oh, is she talking about mainstream?
I don't think Carmen cares whether it's mainstream
Okay.
or alternative news.
There's a terrific reporter on Twitter. His name is Jonah. I'm going to find it and I will put it in the. Actually, I'll tag Carmen out on Twitter. Anyhow, there's a terrific reporter on Twitter who's been reporting on all of it. And I'm going to go find him right now so that we can say. Oh, goodness gracious. Okay. His name is Jonah, Jonah Furman, Furman, at Jonah Furman.
At Jonah Furman, okay.
He's got this strike. Everybody who's about to go, he gives you updates on negotiations, votes. He's doing a great job.
Carmen says, awesome live stream. You can't find such a substantial meeting of the minds anywhere else. Well, thank you, Carmen.
Thanks, Carmen. That's a compliment.
I think it is. Carmen says, Dr. Octo's tentacles will soon reach New Jersey. And Shane says, these are KRTD media trolls. We banned them on the KRTD media channel, but they all make new accounts. He says, haven't seen them in a while, though. God bless you, honey.
Thank you.
And Steve says, at KRTD media, our trolls are similar with a lot of different names. Carmen says, establishment for profit healthcare will threaten states if states actually implement social medicine in fascist states like Florida, for sure. Well, here's the point, though. When it comes to state-based healthcare, if it's good in some states, it works well in some states. If they can't get it in the fascist states, there'll be tremendous pressure on their senators to support a national healthcare program that will cover everyone.
I agree. I think it's how you do it.
I think that's one thing that will work in favor of getting to NEMA sooner as opposed to later. Dolores says, Carmen says, I've been blocking and reporting those trolls all night, Shane. Thank you, Carmen. Dolores Pierce says, thank you and good night, Madelyn and Lisa.
Good night, Dolores.
Good night, Dolores. And Carmen says, night, Madelyn, sweet dreams. And Carmen says, Lisa is a soldier.
Am I? I hope so.
And Carmen says, you sure are. You're 50 lines only. Carmen says, my pleasure, Joe. I'm also wondering if Washingtonians could travel to Canada for drugs treatment. Didn't Bernie take people to Canada for that? Yes, he did. And I'm sure Washingtonians, if they're close enough, can travel to Canada for drugs and treatment. But I think when you get down like to Vancouver, Washington, it's a much longer trip to get to Canada.
It is. It is. I mean, when we lived in Buffalo, a lot of people would go over the border because they sell different kinds of drugs in their pharmacies too, right? And that kind of thing.
But so you lived in Buffalo. When did you live in Buffalo?
87, 88, 86, 87, 88, 87, 88, I think.
We lived in Buffalo. Well, as a couple. First of all, I lived in Buffalo from 1965 to 1971, and Bonnie was brought up in Buffalo.
Oh, really?
Okay, and
That's
I met
cool.
her there when I went there in 1965.
Okay.
In fact, we met on December 28th of 1965.
Aww.
We met at a bar called Cole's. I don't know if you're familiar with that bar. It was really a terrific bar. That's where we met. And the very next day we went out for dinner. I was wearing my corduroy jacket with my elbow patches,
Nice.
and she was worried that I wasn't going to be able to pay for dinner. And Karen says, "My pleasure, Joe. I'm also wondering if watching." Oh, yeah, I read that already. Okay. And Carmen says, "Yes, ARNPs, thanks." And I listed Hoffman for governor of 2021, P.O. Box, and so on. Her address. And Carmen says, "Yeah, that's what she meant." She wondered if the state allows you as a person to euthanize yourself. And I think you said that in Washington, but that's legal so long as you do it to yourself.
If you're, yeah, but I mean, it's been so long. We have to ask one of the nurses, but I know that when we were doing hospice, if one of the hospice patients chose that path, we could not assist them. Like the law in the state is that they can be prescribed the drugs, but they have to be able to take them themselves. And like we weren't anywhere around that because,
Yeah.
But yes, you can do it. And now you have to have a doctor prescribe it to you. So, you're not going to be, they're not going to prescribe it to have a reason. You have to be ill.
Okay, so Lana, we will mention it to Madelyn tomorrow. Lana says here, "I had to duck out for a bit. Did anyone talk to Madelyn about her broken links to donate? I tried to donate to her yesterday."
Really?
Okay, so we will definitely tell her about that.
Okay.
We expect to be in contact with her tomorrow, and I can let her know tonight. She's friends with me on Facebook. I can send her a message on Messenger. Okay, and let her know that you tried to donate. And Carmen says, "Alternative news. I will call Madelyn and let her know tomorrow." Oh, Bonnie is getting me some ice cream at this point. Solana says, "I didn't see any strike coverage today. Jen Dyes was talking about it with Ron Placone on Thursday." Lana says, "Okay, Shane, thanks." Shane says, "No problem." Carmen says, "Thanks, Lisa. My crappy device doesn't have any space for Twitter, but I'll look Jonah up."
He was actually on, was it CNN or MSNBC? One of the two. They interviewed him. He's fabulous.
And Lisa points out in the chat, at Jonah Furman for hashtag Striketober coverage.
Yeah, if you're out on Twitter, the hashtag is Striketober. General strike, but Striketober is for the union laborers that are on strike.
And Carmen says, thank you, Lisa. Shane says, Lana just texted Madelyn. She doesn't know why it isn't working. If you send the check to her P.O. box, she can take that. And Carmen says, great, KRTD. I'll send her an MO when I get extra duckies. And Lana points out Tom Hartman tomorrow. Yes, you sent a note to me, Lana, that Tom Hartman was going to be, was it on the Minnesota healthcare call? Lana says she keeps thinking of Kevorkian. I think Kevorkian was operating in Michigan, if
Yeah,
I'm not
he was.
mistaken.
He was out of Michigan.
Lana says, that is so sweet that you remember the date. That
You met
your wife.
Bonnie.
And the reason why I do is because each year we celebrate that in some way or other. And that means it's really easy to remember. And the other reason why, okay, it's really easy to remember is that New Year's came only just a few days later.
Right.
And so we can always count back from New Year's. Okay, and we know the day of the week, okay, that we met. So we can always calculate exactly that day. Anyway, little secrets here. Lana says, keep thinking of Kevorkian. I keep thinking about his lawyer also. Lana says, also, who else is going to join the Minnesota healthcare call with them?
I would love to go listen to that.
Okay, I can forward you the note that Lana sent to me, Lisa.
That would be great. The more we get involved in this stuff, the better.
Okay, and that also has some other information like Kip Sullivan's email is in there somewhere. And that's a valuable thing to know.
Is that connected up with one pair of states or no?
Yes, that's connected up with one pair of states. I'm not sure the Minnesota. Wait, I guess the Minnesota healthcare call may be connected up to one pair of states too, because there are a number of Minnesota people who are connected up to one pair of states.
Okay.
I think Lana has identified 3 of them already to me.
Cool.
Lana says, yes, Tom Hartman on tomorrow, 4 p.m. Eastern, I think with Minnesota Healthcare. I thought Laura and Lisa and others might want to join.
I would love to.
Steve Day says, thanks, Lisa, and of course, Joe and Bonnie. Thank you for coming, Steve Day. Carmen says, thanks for being here again, Lisa. You're so down to earth. It's a pleasure. And thank you, Joe, for having us tonight. You too, Bonnie. Hugs.
Thank you.
Aw, thank you, Carmen.
Thank you, Carmen. Okay, Lisa, I think we did it.
I think we really did it. I'm exhausted. How do you do this all the time? I can't do this every day.
How do I do this all the time?
Mm-hmm.
The answer is I don't get enough sleep.
Okay, as long as you admit to it, that's a good thing.
Yeah, I don't get enough sleep.
At this time of night, like if I've been up all day, I totally relate to what Madelyn was saying about like I don't trust what's coming out of my mouth. Yeah, I'm kind of there. Overtired. So we
Okay,
got.
everybody, thank you for coming. Thank you for coming, Lisa.
You're welcome. Don't let us forget to get Madelyn a beret. I have to talk to Laura about it.
Okay, and I'll see you next time.
See you next time. Good night, everybody.
Good night.
Good night.
Okay, folks, that's it for tonight. Hope you liked this. I certainly did. I thought it was great. So Carmen says, Joe is a night owl. Me too. Ghost Start says, my body's just waking up. Yeah, Bonnie's a night owl too. That's a thing we really have in common. we like to stay up late. But we've been getting to bed earlier lately because we need more sleep. Thanks, everybody, and good night.